Hello, Lisa Broyles with Way to Health MD, and this video is an update on the current scientific research on stage 4 cancer and ivermectin and fenbendazole, also mebendazole treatments. So I did a video a little while back about ivermectin and some of the proven scientific uses, more specifically geared towards COVID. But this video, there's been a lot of attention online coming out of a doctor in Canada, Dr. William Mackis, who is a Canadian radiologist and oncologist. And Dr. Mackis is treating stage 4 cancer patients with fenbendazole and ivermectin. He's also gathered case reports, and I just wanted to fill you in on the research that I can find as you or someone you know may have stage 4 cancer. First of all, I want to say that ivermectin and fenbendazole should not be considered as single therapy if you are diagnosed with stage 4, which means metastatic cancer, okay? The mean survival for people that have been diagnosed with stage 4 cancer is usually 9 to 11 months without some sort of chemotherapy, at least for palliative care. And when a doctor says palliative care, what they're meaning is these drugs will not save your life. They will not make the tumor go away, but they will slow it down enough to give you more time and to make you more comfortable. That's the true definition of palliative care, and that's typically what's offered for stage 4 cancers, as it's very rare for there to be a complete cure. What I have is a report, 150 case reports that have been gathered, and case reports are not true scientific evidence, as they are not evidence-based, placebo-controlled, randomized clinical trials, okay? Those have not been done yet on fenbendazole, but some stage 1 and stage 2 human trials are underway on ivermectin, showing its promise against cancer. So ivermectin does have solid science for how it actually works against cancer. So ivermectin induces something called apoptosis, which is cell death of cancer cells via multiple signaling pathways. There's one called mTOR, there's another called B-catenin, but these pathways cause the cancer cells to shrivel up and die. Okay. The other thing that ivermectin has been shown to do is it disrupts the mitochondrial function within the cancer cells. It creates oxidative stress on the cancer cells to encourage them to stop replicating and die. The other cool thing about ivermectin is it can actually reverse some drug resistance against chemotherapy agents, making the patient's body more sensitive to those chemotherapy agents again. So some cancers that have seen success with ivermectin include breast, prostate, ovarian, colorectal, leukemia, hepatocellular, which is liver, and glioblastoma, which is brain. So I think the important take home for ivermectin is that there is a little bit more research coming through the pipeline about its use in combination with different chemotherapy agents. I would recommend that if you have stage 4 cancer and you find that your chemotherapy is not reversing, then I think it's reasonable to add ivermectin, and apparently it seems to be synergistic in a tandem benefit when you use ivermectin and fenbendazole together along with conventional treatments for stage 4 cancer. So I want to be clear that I'm not advocating ivermectin or fenbendazole be used exclusively to treat cancer. This I don't think will work. But I think for people that already have stage 4 cancer, the typical conventional treatments are not working or making you too sick, then I think it's reasonable to then add fenbendazole and ivermectin treatment to your regimen. So the fenbendazole science has been done in labs like in vitro, so test tubes, and in animal models, but we do not have any good human clinical data yet on fenbendazole. But I will say that the science behind it in the initial studies is promising. It does seem to inhibit cancer cell growth by inhibiting glucose metabolism. So it stops the cancer cells from being able to uptake sugar, which is what they need to survive. So it also suppresses the tumor by increasing an anti-tumor gene that we all have called P53. So when we have more P53 gene activation, then it helps suppress cancer cell growth. So this has been really exciting, again, in animal and in vitro trials, but no human studies have yet to show fenbendazole effective. However, Over 150 case reports have been collected of patients that are stage 4 cancer who have seen incredible reductions in tumor cell. So you had significant tumor volume reductions, as much as 99.7% reduction of pancreatic cancer. Some patients reporting cancer-free status where they can't even find the cancer after treatment with ivermectin and fenbendazole. We had a CA19-9, which is a tumor cell marker that dropped from 44,960 to 21 in pancreatic cancer. So there definitely have been case reports of patients who have seen amazing results on these. You have to just understand that case reports are collected through online, what this patient or their family posted on social media. These are not a doctor looking at the information and being able to see causation all the way through. Most of these case reports, these patients have also been on conventional chemotherapy agents. So it's really hard to figure out, well, what was the difference? Although in many of the case reports, the patient was doing poorly until the ivermectin and fenbendazole was added. And I will say, as a caveat, mebendazole added in the presence of a brain tumor called glioblastoma seems like it's really improving favorable outcomes. Unfortunately, mebendazole is incredibly expensive. Fenbendazole is very inexpensive here in the US, as is ivermectin. So I've attached a link to some of the studies that I'm referencing if you would like to look at them yourself, as well as the case reports. Please talk to your oncologist before you make a decision to take fenbendazole or ivermectin, but if you wish to discuss it with me as well, there are some therapeutic doses that have been roughly established. Again, more studies are needed, but I would be happy to talk to you. Thank you.